The Community Cancer Institute is the newest member of the University of California Hematologic Malignancies Consortium. To explain what that means and how that benefits blood cancer patients in the Central Valley is the Director of Hematology at UCSF Fresno, Dr. Haifaa Abdulhaq.
We are the newest member of the UC Malignant Hematology Consortium. This consortium is a collaboration between different University of California sites that enables patients to have access to clinical trials and being enrolled in those trials without having to travel to other sites to have that. Being a member of the UC Consortium provides a great opportunity to our patients who have blood cancers like leukemia, lymphoma, multiple myeloma, and myelodysplastic syndrome. So let's say we have a patient with blood cancer who has progressed or did not respond to the standard of care, and he or she are in need of newer treatment. And there is a clinical trial or a study for this new treatment outside of Fresno. Without being part of the consortium, this patient will have to travel either to the Bay Area or to Los Angeles for them to be able to be part of that trial and to have access to that newer treatment, whether it is a pill, a targeted therapy, or an IV immunotherapy. By being part of the consortium, we are bringing those trials here to the Valley, and the patient will be able to have that treatment without having to travel. So they will have the ability to have the treatment while being amongst their family and their support system, and without having to go through the hardship of traveling outside. So the advances in the care of cancer patients come through studies and clinical trials that eventually lead to approval of new treatments. So for any new treatment, it has to go through different phases of studies for us to evaluate the safety, evaluate the efficacy of this drug, and then eventually to get approval from the FDA. So having the access of clinical trials, that means being able to be on these new treatments years before they get FDA approved. And that would be a very good opportunity for patients so that they can have these newer treatments, including immunotherapies and targeted therapies that otherwise they wouldn't have had for many years. We are very excited to have this opportunity for us. Because now we have access to truly the leaders in treatment of blood cancers in the whole country. And we are also excited for our patients because they have the state-of-the-art treatment here in the Valley.